So we're going to move on to Floradix. Of course, this is the main product in the liquid tonic line. And I hope by going through this presentation, you'll get an understanding of what the benefits of using Floradix are and how you can safely use it for many people. Floradix is a product that's really dear to my heart. I started taking it when I was in high school and have used it throughout my years as a naturopathic physician and a midwife. So it's a product that has worked well for me personally and also worked very well for me in my practice. So why is iron deficiency such an important thing? It is the #1 deficiency in the world. It's actually the #1 deficiency in women worldwide. It's the leading cause of women being fatigued. And the frustrating thing is that women that have fatigue because of iron deficiency never have to live with it. It's totally preventable. And when we go through the slides, I'm going to show you how. One of the things I find frustrating is seeing women completely debilitated by iron deficiency. This is supposed to be the best time of your life when you have the best health, and you're dragging yourself around. I see it all the time in my practice. And again, it's something simple that we can treat and prevent, and Floradix is the ideal product for that. It's estimated that 400 million worldwide are anemic, and more than 1 billion women in the world are low in iron. It's actually been linked with complications with pregnancy, depression, PMS, and decreased fertility. Those that are at the highest risk of deficiency are children under the age of 4, and that's because it's the most rapid growth period of their whole entire life. And anytime you're growing tissue, you need more blood vessels, more blood volume, and that's why the demands are that high. From 6 months of age on, the demands for iron are as high for a child as they are for an adult male. Teenage girls, and this is partly due with the start of their menstrual cycle, also with some interesting eating habits and eating disorders contribute to that as well. And also this is a time where people are quite active. So those all contribute to iron being lost. Teenage boys also suffer with iron deficiency. That's probably the most common time you'll see a deficiency in men. Pregnant women, because they have double the demands of iron while they're pregnant due to their increase in blood volume, their demands to pass on iron stores to their baby. And so this is a very important area. And elderly, and this is because of their decrease in absorption of minerals as they age because of loss of digestive enzymes and of poor eating habits, and also change in their dental work because it makes it difficult to chew, and that decreases the amount of nutrients they get. Okay, what is the function of iron? The main thing is it's part of hemoglobin, and its job is to carry oxygen around the body. So there's four irons in each hemoglobin, and they carry oxygen around to the body. It's also part of the myoglobin, which is is similar to hemoglobin, but it's found in the muscles. So it helps give you that start when you're exercising to deliver oxygen right away. It's also needed for aerobic metabolism, so when you're up for that jog, you need iron to keep you going. It's needed for a variety of enzymes, including detoxification enzymes, enzymes to prevent free radical damage, and also it's involved with making ATP, which is basically the fuel for every single cell in the body. In addition to that, it actually makes steroid hormones like progesterone and estrogen, and that's why it's been linked with a deficiency you see with problems with fertility. The other thing is it's linked with production of the thyroid hormone as well. So some of the symptoms overlap with iron deficiency and thyroid. So people think they have a thyroid problem, but they may have an iron deficiency. Why do people feel so tired when they are low in iron? When they have lower iron, less oxygen is being delivered to their body, and that's what lowers their energy. The other thing is that there's less ATP, less fuel in every cell. And this is an important thing because later on we're going to talk about why pre-anemia is so important, because what we're realizing in research is that changes happen with the thyroid, with the heart, with symptoms of iron deficiency well before the hemoglobin changes. And this is part of the reason. Iron has many other functions besides just carrying oxygen around the body. Okay. So let's look at some of the symptoms of iron deficiency. You'll have paleness underneath your eyes, particularly if you pull down your eyelids. Underneath here, it'll look very pale. If you look at your nails, they'll look quite pale and they can become brittle and break easily. And if you look at the palm of your hand, the lifeline should be darker than the rest of the palm of your skin. If it's not, that's a sign that you're iron deficient. Usually your hair becomes brittle, and again, people will complain of hair loss during that time. And one of the things that will also happen to your nails is that they can become spoon-shaped. But if your nails have become spoon-shaped, you've had an iron deficiency for a significant period of time and you've missed it, you'll have pretty severe symptoms by then. Again, I talked about pulling down the eyelid. That's a very important one to look at because that's often where you see the paleness. People complain of having a rapid pulse, just going up a flight of stairs, all of a sudden your heart starts racing. Some of the other symptoms, again, I've talked about the fatigue and weakness, and how it feels in terms of fatigue is you kind of wake up tired and go to bed tired. You kind of push yourself through the day, but you always feel a little bit lethargic. The other thing to watch for is repeatedly getting sick. Someone who says, you know, I feel tired all the time and I catch everything in the office, that's a big red flag for me to look for iron deficiency. And partly it's because it impairs the immune system. The other thing is having a hard time getting through your workout. It makes it a lot harder to exercise if you don't have enough iron. It makes sense, you need a lot of oxygen to exercise. Shortness of breath going out of a flight of stairs. You may start getting heart palpitations even at rest, having a hard time concentrating on any task. Some people complain of not being able to sleep well. Some people get depression. It's been linked with iron deficiency as well. Feeling dizzy as soon as you stand up. Sore tongue, because actually if you have an iron deficiency, what happens is you can get canker sores, and the taste buds themselves actually atrophy a little bit, and that's what causes the sore tongue. Cold hands and feet, which again is commonly thought of as a thyroid symptom, but it's also an iron deficiency symptom. Some people get ringing in their ears and restless legs and chest pain during exercise. Restless legs can be also magnesium, so it's something to look for. Okay. One of the most important things I like to emphasize to people, if you developed an iron deficiency, you cannot correct it with diet alone. That's because you need a minimum of 30%, 30 milligrams of iron in your diet. The average American only gets 8 to 10 milligrams, so it's very difficult to increase to that level to correct an iron deficiency. Part of the challenge is that we only absorb 5 to 10% of iron from our diet. With a good quality supplement, it can be up at 25%, so that's an important thing to look at. Now, we're going to move on to an exciting area called pre-anemia. And that's important because this tells us how important low-dose iron supplements are for the correction of iron deficiency. This is probably one of the most undiagnosed conditions, and this is iron deficiency, which is low iron stores. It's a test called serum ferritin. But you have not become anemic yet. That means there's been no change to your hemoglobin. If you leave an iron deficiency long enough, it can lead to anemia. But what happens is, first, your serum ferritin changes. That's your iron stores. And what the research is showing now, as we go through some of the studies, is that when you drop your iron stores, symptoms are already developing. And so that we need to treat here. We need to treat here because it's easier to treat at that point and easier to correct, so people's symptoms aren't as severe. And we don't have to use this high dose of iron supplements, which is one of the reasons I love Floradix, because it has that lower dose, which is safer for people over time. Then what happens is the circulating iron in your blood declines, then the size of the red blood cell becomes very small, and then your hemoglobin changes. You have to actually almost completely deplete your iron stores before your hemoglobin will change. So you can see that that is a problem. It doesn't just come out of the blue. You can be iron deficient for years, and I pick up missed iron deficiencies in my practice every single day. The most important thing to remember is the test that is the gold standard for checking for iron deficiency is serum ferritin. So what are the three main symptoms we see with pre-anemia? It's hard time exercising, poor concentration, and poor capacity to get any work done, whether it be physical or mental. So let's look at some of the studies. This was a study done in 1996. We actually have a recent study that hasn't yet been made available because it just got released this month, showing that teenagers, about 25% of teenagers are iron deficient. This was a study done on non-anemic, so they just had low iron stores who were supplemented with iron, and they found that they significantly improved their verbal memory and learning and memory. The most recent study done has shown that those teenagers that have an iron deficiency also have a lower IQ. This is a study done with looking at women who could not get pregnant. People could not find any reason why they weren't getting pregnant. But when they looked at their serum ferritin levels, these again were women with normal ferritins, they had low iron stores, and they found that anything under the level of 40 that you would have a hard time conceiving. Interesting enough, right now we're defining that you're not, your iron stores are not low unless you're at 15. And look at this study showing you've got to be at 40. A study from Denmark showed that the levels going into pregnancy should be around 70. And so we also have been underdiagnosing a problem for fertility by only accepting 15 as an okay level. My goal is at least to get people to 25 to start with. This was a study done on fatigue. These were women, this is 136 women. They had fatigue. They'd had a physical and lab work. They couldn't find any reason why they were fatigued. They looked healthy. When they ran serum ferritins, over half the women that had unexplained fatigue had low iron stores, showing that this is an extremely underdiagnosed problem. They also know that in exercise that iron can be lost through sweat. It can be lost through bleeding the digestive tract with digestive jarring, and that is common with runners and impact sports. Also, if you're a runner, when you have that heel strike, you lose, the blood vessels break, and that causes loss of blood. So it's very common to see it in athletes, but surprisingly now we're finding even in untrained people just starting an exercise program, or people in an exercise program, we're seeing iron deficiencies in sort of the average population of fitness. This was a study done with 41 women between ages 18 and 33, and they had iron deficiency or pre-anemia. When they supplemented them and look at the dose, only 16 milligrams, they had improvement of exercise endurance and returned their iron levels to normal in only 6 weeks. The reason I emphasize this is that they found that if we use 20 milligrams of iron a day, which what I'm going to talk about later, you can't get into an iron overload situation with only 20 milligrams of plant-based iron. We can correct iron deficiency for 4 out of 5 fertile women, the women in their childbearing years. And this is why I said that it's completely preventable. If women in their, basically from their teen years to menopause, took 20 milligrams of iron a day, this would be completely preventable. This is another study done on exercise. Women received 10 milligrams of iron twice a day, and they improved their exercise endurance by 15% and their muscle strength by 26% over a 6-week period. This is a study we've always thought that women need to have higher iron levels in pregnancy, and that's absolutely true. But here's a study showing that 20 milligrams of iron, given at 20 weeks till delivery, prevented iron deficiency and iron deficiency anemia at delivery and also in the postpartum period. Women who take iron supplements in their pregnancy have significantly less anemia and iron deficiency during the pregnancy, but as well as the postpartum period. It also has been linked, pre-anemia has also been linked with PMS. When they did a study with women with PMS, 53% had lower intake of iron than those without PMS. Okay, so we're going to move on to talk about iron absorption and iron overload because this is a very misunderstood area. So iron absorption will increase when your iron stores have gone down or if your red blood cell count has gone down. You can absorb about 5 to 10% from your diet in a healthy person who has normal iron stores. If you're deficient, that goes up to 10 to 20%. Your body compensates and allows you to absorb more. The whole key is you can only absorb about 10 to 15 milligrams at a time. And this is why one of the reasons when these higher doses of iron, often the minimum dose you can find in a capsule is 25 milligrams, and it's staying in the digestive tract, it's not being absorbed, and it's causing constipation. One of the beautiful things about Floradix is you can divide the dose over the day to get that maximum absorption. So I said from the diet you only can get 5 to 10%. From ferrous sulfate, which is one of the most popular forms of iron, the absorption is only 12 to 16%. Ferrous gluconate, which is the form we use in Floradix, is 17 to 25% absorbed. So it's a much better, so that's one of the reasons it's also non-constipating, because you can just absorb more of this form. So you don't need as much. So there's a big difference between the way heme iron and non-heme iron absorbs. Heme iron, of course, is from an animal source. It has to be from a flesh food. Non-heme is from a plant source and also from eggs. Heme iron, it's cleaved from the food and then it can be directly absorbed from the small intestine into the blood. And because of that, you can see in the chart that the iron is just going right into the blood. It doesn't require a carrier, it can just go across freely on its own. The problem is that there's no shut-off mechanism when there isn't, your body has enough iron. So you can see that in this slide, the heme iron is completely maxed, or the iron is completely maxed out in the blood, but the iron is still absorbing. So the research shows that if you're iron deficient, you'll absorb heme iron at a rate of around 35%. But if your intake is normal and your iron levels are normal, you'll still absorb a rate around 20 to 25%. So you can see the problem with iron overload and heme iron or animal-based iron. There's just no way to shut it off. So even when you go back to a normal level, your body just keeps absorbing it and absorbing it and absorbing it. Plant iron requires a carrier to get to the digestive tract. And so that means that it's going on a boat. That's the way I describe it. The iron's getting on a boat and traveling across into the bloodstream. What happens is when the body has enough, so the hemoglobin levels are normal, the iron stores are normal, the body feeds back to these boats and says, you know what, don't pick any up, because we have enough and we don't need any more. So you can see now that the blood is now full of iron, and so now none of the boats are picking up iron. So what research shows is that when you're iron deficient, you'll absorb around 20% of non-heme iron, but when you have adequate amounts of iron in your blood and your iron stores, your rate goes down to 2 to 3%. So you can see the protective mechanism with plant-based iron. And in fact, there's no link. There's an extensive study done showing no link with plant-based iron and plant-based iron supplements. The only exception to that was if you use really, really high doses of plant-based iron, then you can start passively diffusing, which is basically the iron's going through the layer of skin in your small intestine. So this is the other reason we should only ever use low-dose iron supplements for prevention. Okay, so now we're going to move on and talk about iron overload. And then we're going to have a chance to talk about the Floradix product itself and the recent study that's been done on it. So iron overload, the studies have shown that men who consume a high amount of animal iron have problems with iron overload. And there's been no link with plant-based iron in the research that has been done in Finland, in the US, and Africa and Australia. It has all been with meat-based iron, with the exception of Africa that has beer that's made in an iron vat. And they've found some problems with iron overload there. So again, I've talked about there's no feedback mechanism to turn off this iron absorption, and that's where we have a problem. Again, I talked about the fact that non-heme iron, it has this protective mechanism, so you can reduce the absorption to 2 to 3% when your iron levels are at normal. So let's look at the heart disease studies. These primarily were done in Finland, and they found a correlation with Finnish men and excess meat consumption. And the men that had higher iron stores and also higher cholesterol had higher rates of heart attacks. But this was a study done in Canada, and we need to look at, are we comparing apples to apples or apples to oranges? The Finnish men have higher iron stores than Canadian men, and American men have similar statistics to Canadian men. The average iron store for a Finnish man was 166, where the average Canadian only had iron stores of 92. They also found that the Finnish men had a higher intake of cholesterol and lower intake of antioxidants. So it makes sense that they would have a higher rate of heart attacks for that reason. The average intake of iron for men in Finland was 19 milligrams. The average North American only consumes around 10. So you can see again, they were more consuming higher levels than we do. The men in the non-heart attack group in Finland had data similar to Canadian men. So this is where we have to remember that we're not comparing apples to oranges. So we have taken the Finnish data and we've extrapolated it to every man in the world, and it doesn't necessarily work. Let's look at some of the other research about the effects of whether you're iron deficient. What they found is that at the time of a heart attack, that if you are anemic, you have a higher rate of dying from that heart attack. So it makes sense that it's not good to be deficient. They've also found that we see abnormal electrocardiograms, which is basically checking the rhythm of your heart when you're iron deficient. And we see this is why you see the heart palpitations with iron deficiency. And this is corrected with iron supplementation, but it's corrected well before the hemoglobin changes. So they feel that iron's involved with the enzyme system for the conduction of the heart. So this is a very important thing. They also did a study recently of 4,000 men and women and found low iron status a powerful predictor of death of all causes, but particularly heart disease. So again, not good to have too much iron for heart disease, but not good to be deficient. So we want to use a prevention supplement that doesn't cause iron overload. Currently, the American Heart Association recommends that there is not enough studies, conclusive studies, to make a link with iron and iron overload. For example, meat has been linked with higher saturated fats, higher cholesterol, so we don't know yet if it's the iron itself or other components in the meat. So that doesn't mean you shouldn't be cautious, and how we need to be cautious is to eat a variety of diet and make sure that we never use heme iron for prevention. Let's look at some of the cancer studies. There have been studies that have shown that if you have excess iron stores, that this has been linked with an increase in cancer. However, the studies are not yet conclusive. This was a study done, this was what we call a meta-analysis. They took 60 studies and they combined them to look at cancer patients. And they found that those patients that were anemic and also had cancer, their survival times were reduced. So it is important that we, again, don't ever give a cancer patient excess iron. But for example, someone on chemotherapy is immediately can become iron deficient because of the destruction of their digestive cells, so they're not going to absorb well. The message I want to give you is that iron overload and iron deficiency, they're kind of mirrors of each other. Neither of them are beneficial for the body. And that how we can prevent either from happening is to avoid excessive consumption of red meat and get your iron from a variety of sources, and make sure that you always use plant-based supplements in lower doses. Do not use them in therapeutic levels, and we will never get into a situation with iron overload. Okay, so we're going to look at Floradix, the product itself, and its unique formulation. It was designed for treatment and prevention and treatment of mild deficiencies. It's a non-constipating formula. It's ferrous gluconate fed to brewer's yeast, and what the advantage of that is first of all, brewer's yeast is rich in B vitamins, and when it's fed to brewer's yeast, it actually becomes part of the brewer's yeast itself, so it becomes part of a whole food complex, and I think that's a huge advantage. There's also herbs that are rich in iron, spinach, nettles, and kelp. There's rose hips, vitamin C, B12, and fruit juice, all that have been shown in research to enhance the absorption of iron. Cofactors B12 and B6 are there to help make red blood cells. This is a very important thing, having the B12 in there, particularly for seniors, because they often concurrently are B12 and iron deficient. And if you supplement with B12 alone, you will actually make an iron deficiency worse. So this is crucial. It is a plant-based supplement. It's suitable for vegetarians and vegans. It uses digestive herbs to aid absorption, which is one of the main ingredients. Let's look at the Floradix study. This was very exciting because it confirmed for us what we were seeing in the pre-anemia studies. This was a study done with women between ages 18 and 65 who had low serum ferritin, so low iron stores but weren't anemic. And half the group were given just increase your diet with iron-rich foods, which we always suggest. And the second group was given suggestion to increase their iron-rich foods, but also take the Floradix supplement. In this chart, you'll see that the gray is the control group and the yellow is the Floradix group. And you can see at 4 weeks, there's a significant difference in iron stores between the control group and between the Floradix group. And that's a very common reaction to Floradix. The response is very quick. People will notice that they feel better within days of starting the supplement. And you can see at the end of the study, which was 14 weeks, that Floradix had normalized their stores to 25, where the control group was still around the 16 mark. And why this is important is that you can also see when you look at this chart that it's starting to plateau, which is exactly what we'd expect. And this is the reason why you can't have iron overload with low doses. And it's this next chart here. You can see if you're taking 30 milligrams of iron a day and you start out with low iron stores, what happens is your body plateaus. And that's because of that feedback mechanism to say, I don't need anything. So it plateaus at that 25 level, which has been shown to be beneficial for that it's been shown to be more of the ideal levels for iron stores. So this is a crucial thing to look at. So the other thing is we've always said this is a non-constipating formula without stomach upset, and 90% of the participants were able to take it without any side effects, which confirms what we've said about our formula all these years. The other thing is by how people felt. 70% in the group that took Floradix felt that they felt good or very good versus only 28% in the control group. And that's a common thing we find when people take Floradix. They say, I'm feeling so much better. So again, Floradix has been shown to be exactly what we have designed it for, and that is for prevention of iron deficiencies and for treatment of mild iron deficiencies. It can be taken at higher levels, at least 60 milligrams if people have a significant anemia. But the prevention dose of 20 milligrams to prevent iron deficiency and the 30 milligrams for pregnant women and to treat mild iron deficiencies are ideal. So how I use Floradix is for the prevention of iron deficiency, for treatment of mild iron deficiency. When a woman has heavy periods, she immediately loses too much iron every month. She needs to be at that 30 milligram level, else she'll always be in the negative for her iron. Any person who has digestive problems, particularly that causes loose stools, will always end up in an iron deficiency because they're just having it go through too quickly. I use it for athletes because, again, it's common that we see iron deficiency in endurance athletes and athletes that play contact sports. And I can honestly say I spent 15 years playing rugby and I struggled with iron deficiency almost through the